Hey guys, welcome back to No More Cavities. Today we are discussing the anatomy of human skull. So first of all, we will discuss different bones. What is a skull? The whole bony framework that you are seeing right now is known as skull. And what is cranium? If this bone called as mandible is removed from the skull, the remaining thing is known as cranium. The cranium is divided into neurocranium and the viscerocranium. What is neurocranium? Neurocranium means that the bones that house the brain, while the viscerocranium are those bones that form the face. So we will be discussing each bone differently. First of all, the bone that we are discussing is known as frontal bone. So what is frontal bone? This bone is frontal bone. So the frontal bone have three processes. This whole one is known as squamous process. The process that is contributing in nose is known as the nasal process of the frontal bone, and the process that is contributing for eye is known as the orbital process of the frontal bone. Then the second bone that is contributing in formation of the face is this bone, which is known as maxilla. The maxilla have different processes, such as this is the zygomatic process. This is the zygomatic process of the maxilla. This is the alveolar process of the maxilla, which is housing the upper teeth. And this is the frontal process of the maxilla. And this is the zygomatic bone. Zygomatic bone have also different processes, such as the frontal process of the zygomatic bone, the orbital process of the zygomatic bone, and the maxillary process of the zygomatic bone. This bone here, which is contributing for neurocranium, is known as parietal bone, and the bone here is known as temporal bone. The neurocranium is formed by the frontal bone, the parietal bone, the temporal bone, the ethmoidal bone, and the sphenoid bone and the occipital bone. This bone present here is known as mandible. This bone does not articulate the skull with the help of any type of suture. Hence, it forms a joint known as temporomandibular joint to connect with the skull. The mandible have different parts, such as this is the alveolar process of the mandible. This is the whole process, which is known as body of the mandible. This is the ramus of the mandible, while this is the angle of the mandible. This is the nasal bone. Now we are discussing the different sutures that are present in the anterior view of the skull. What is suture? It is a point that join two bones. So this is frontonasal suture. It means it joins the frontal bone and the nasal bone. This is intermaxillary suture, which joins two maxillary processes. This thing here is the zygomatic-maxillary suture. Now we will discuss the different foramina. And what are foramina? Foramina are those holes that houses any vessel, any artery, or any nerve. So these are supraorbital foramina, these are infraorbital foramina, and these are the mental foramina present inferior to the second premolar. This was all about the anterior view of the skull. I hope I made it very clear. Thanks for watching.